So it has now been a couple weeks since we've spoken.
hmm
Who would have known? I mean, that just this is still going on. How are you doing in Austin?
Things have been good. We have been, as if you've watched the news, Texas has been pretty aggressive about reopening, and
Yeah.
so we've. I feel like we've been a little test center for a part of the of America because we've been aggressively opening. At this point, everything is open to some capacity. Pools, salons, plastic surgery, us. Gyms have even opened, and so maybe not all to 100% capacity, but we're up and running.
And now from what you've been able to see, has there been any with this reopening, has there been any resurgence of coronavirus, or is it too soon to tell?
It's a little soon to tell. We'll see where we're at. I actually was talking to somebody who's one of the lab directors of one of the big labs here, and they said that they've been pretty steady at 4%, and they're doing about 6,000 tests a day at their lab, and 4% has been pretty steady over this entire month. And they thought that there would be a really big spike as stuff opened, and they haven't seen it yet.
Oh,
So
that is
keep our
such
fingers
good
crossed.
news because I cannot, I think like so many people, I'm over it.
It's hard. I feel like we can't be on house arrest forever. It's been hard.
No, so
I don't think people realize how mentally tough it is. And it's a spot that I think people forget because everybody starts to feel a little isolated, a little depressed, a little down. And you just can't be separated from all your friends, family's life and not have it affect you at least a little bit.
well, sometimes I feel like I was talking to a girlfriend the other day, and she was saying, it's almost like it's just stagnant, right? And they say New York on pause here, New York, or wherever you are on pause,
Mhm.
but that it even though life goes on, that when you're in the same location, it's hard to sort of tell the different days, and it almost feels like has life just stopped and has my progress stopped? And it can be a little bit of that mental, like just like a little mentally challenging to deal with that sort of idea of, am I moving forward? Am I doing that? What's the purpose?
100% because I feel like days get lost and there's so many things that we've just put on hold and you're like, oh, I'm not going to do it this year or I'm going to do that. And so for those of us that are a little bit of procrastinators, this is like times 10 for us.
You know what? It's also funny that you say that with the procrastination. There is something about this constant feeling of like, I should be doing something.
hmm
So I should be painting the kitchen, or I should be organizing my drawers, or whatever it is when we're stuck at home, that it's like you can't even relax because you just then feel guilty. Like, I don't want to do anything, but I really should be doing something.
And it's hard not to worry, about when is
Yeah.
this going to end? How is this going to affect? Because I think there's a trickle effect along everywhere, even if you're an essential business, this or that. But there's supply chains. I mean, even for us, we've had to change how we order supplies for our office because of shortages, backlogs, and it's different things that people don't realize that everything gets affected.
Oh, it is a trickle down effect. And for people who are just tuning in right now, Ryan is on vacation, and I have the pleasure of bringing back Dr. Johnny Franco from A More Beautiful You Plastic Surgery in Austin. I love that we sort of caught up at the very beginning of
Mhm.
all of this, and we're sort of talking, about how the coronavirus was pushing aesthetics to go viral. I mean, rather to go virtual,
Mhm.
telemedicine. And here we are now, a couple months later. Um, and it seems to me like certain things, telemedicine is here to stay.
If we're going to look at the bright side of things, telemedicine is a huge one. And I don't know how much I can't remember how much we talked about this in the past, but I think that's going to be a huge step forward for us. And one of the big limiting factors in the past was insurance reimbursement, and something that we don't do a ton in my world, but was a big holdup for your primary
Yeah.
care doctors, general surgeons, those type of things. And there's been some legislative changes that have forced it, and I think it's going to make access care better. If you think about the regular flu, it makes sense to not go into a busy office and spread it among a bunch of people. So I think there's going to be some really good leaps and bounds. And I think even from our office, there's some efficiency stuff that we've changed to make it a better experience, so that just from the old days, and anyone who's ever been to a doctor knows, and I apologize to everybody, but you go You wait for half an hour in the main waiting room. You get moved into another room. You think that it's your turn, but no, you're just waiting another 20 or 30 minutes.
So you doctors do know and get it. Good. I'm so glad because you nailed it. You really did. And on that, like, so for those of us who haven't been able, that we aren't open yet, what do you think a doctor's visit is going to look like? I mean, how is that going to change?
Well, I'll tell you what we're doing here in Texas, since we've already opened our medical offices, is like probably a lot of people do for restaurants now. We have a curbside check-in. So you call us when you get here. We make sure that when you come up, you can basically walk right into your room after you do a screening questionnaire. Have you had a fever? Have you had X, Y, and Z? And make sure that's good. We check your fever as you get to the door, and then you get taken right into your room. So it's done a couple things. One, we've had to expand our hours to try and accommodate people. Two, inpatient in office consultations are spaced out a little further. So we really push everybody to do an initial virtual consultation because we can answer most people's questions. We try and send people a lot of things ahead of time so that they can review it at home. So again, you're not stuck in the waiting room filling out paperwork or doing those type of things.
But man, I mean, essentially what you're saying is for the doctors, longer hours, less patients. I mean, somewhere that model's going to have to break, don't you think?
100%. And some
Yeah.
of it has been trying to find a happy place, and it's not
Mm,
even just those things. The extra PPE that everybody's purchasing, which isn't cheap. Right now, we're COVID testing everybody prior to surgery. And all those things are extra steps. And then people forget about the manpower or woman power, depending on our staff, but of helping patients guide through this because it's an extra test. And for us here in Texas, testing has still been a little bit of an issue, especially some of the rapid tests to be able to get tested right before surgery. Because a test saying you're negative a month before surgery, I don't know how much that helps us.
right.
Um, that's still been a work in progress. Is a lot of these labs, like my friend who they went from 1,500, 2,000 a test to between 6 and 8,000 overnight. I mean, that's
Right.
that's a hard jump for most
It's
people.
a hard job. I mean, my husband and I went, and I think when we last spoke, I told you I thought we had it because we lost our sense of smell.
Hmm.
So we went for the antibody test. Both of us tested positive. I'm pretty sure that we had it because again, we lost our sense of smell.
Hmm.
But now the CDC is saying, well, only about half of the tests are right. I mean, it's maddening in some ways, and in other ways we just have to understand, it's a lot of pressure on a system that has tried to adjust rapidly and is really doing the best we can. But in terms of like the changes in the doctor's visits, do you think that having to wear masks, I would almost think that having that sped up time is going to encourage a lot more people. Like, I can do this, and I can probably really do this on my lunch break now because I don't have to go and sit in an hour, if I get in and out. But I'm wondering if you think that some of the protocol might be discouraging for people to have cosmetic surgery.
I'll tell you, for us, it's actually been the opposite. And I think some of it has been the working from home, people who are making use of time that they're either furloughed or off work or know that they're going back in July and August. And so the pressure to try and get people in because they know they're going back in July, August, September, something. They have a date they know when they're going to have to report back is hard because they're like, look, I can't be off for 4 months and then turn around and ask for 3 weeks off to recover. And so
It's true.
trying to trying to accommodate people has been hard. I would say there was a little bit of pushback at the beginning, but people have in turn loved it because, as you know, a lot of people were homeschooling, taking care of their kids, and so to leave for what might be a 30-minute visit with me, but 3-hour round trip by the time you drop them off at friends, whoever's sitting, and then pick them up and so forth is hard. And so this has been there's been obstacles, but there's also been a lot of opportunity.
I think it's interesting that you say that because I think for every, person who is like myself and cannot wait to go back and get Botox, there's a lot of people who are like, what are you, crazy? Um, and I'm wondering, you mentioned the PPE earlier.
Mhm.
Have you found that, do we feel pretty confident now? When we spoke last time, it was like, don't use the PPE on anything that's non-essential. Have we crossed that boundary enough that you feel like it's not going to be taboo to go and get your Botox or filler?
I don't think so anymore because I mean, especially here in Texas, restaurants have opened, gyms have opened. For us, it's been across the board that uh, our hospitals have never been. And in fact, it's been the other where some of the hospitals are hurting because we use the term elective surgery, and most people think of breast dogs, tummy tucks, but that also includes,
Yeah,
from a
your hip
government
replacement.
statewise, it's much broader. They joint replacements, colonoscopies, carpal tunnel stuff that most people don't realize is elective falls into that category. And most hospital surgery centers depend on that to
Right, to make
support
money.
their ERs because those that bring in money support the ERs and stuff, which will treat anybody, whether people pay or not. But that money has to come from somewhere.
Yeah, it sure does. And it's I think that it's always interesting to look at, like you said, the trickle down effect of things, right? And again, we're still so early in this. None of us know what's going to happen. But I was speaking with another doctor who said, my patients are noticing even more because everybody's been on Zoom calls. So they are calling to line up things because now that she had found that there was going to actually be more of a rush to get plastic surgery. I've read some other places where doctors have said, well, there's going to be, is it going to be taboo to look done? Right? There's a difference between getting a little bit of Botox and then, some people like that done look. And will that be a little bit more taboo? Do you think that there's going to be a trend towards the more natural?
I don't think so.
No. Okay. Gotcha. Well,
I think the more time that people spend in front of cameras, Zoom, selfies, FaceTime, we look at ourselves and we're our worst own critic. And so people
sure.
they can't get in fast enough in terms of that. And I think there is, more of it than just the PPEs. I think it's being, responsible from a physician standpoint. The part that I would say that is really hard and be interesting to, what some of your other physicians have said is it's a moving goalpost
Yeah.
because recommendations change pretty frequently and to nobody's fault, but this is new. There is no standard, there is no set protocol. And so as information becomes available, things change. And for us, we've probably changed our office protocol 3 or 4 times since our last talk, um,
Sure.
as we've tried to adapt to new recommendations as they come out. And
Well, and I think that also people, I've got certain friends who have been already told, "Hey, you don't ever have to come back to an office." And then I've got other people who are, yep, you're going to have to get that going. And then other friends who have lost jobs. So things like Botox are just not within their, they're worried about paying the rent, right? So a lot of people who would have, been getting procedures and had a little bit of extra money to spend might not. That aside, do you think that, in general, as there has definitely been this shift for the whole medical community to be focused on coronavirus.
mhm.
Um, do you feel like in general when something like this happens that it means that there's just going to be less innovation in the field of aesthetics in general?
I don't think so, because I'll tell you, we had more educational events in terms of webinars, online training, other things. If anything, I feel like it gave people a chance to catch up. It gave
Oh,
people a chance to review. I think I've done my CME credits for the next 15 years over these last 2 months. And so, I think it's given people a little bit of a chance to catch up in terms of these. And I think even implementing stuff in their office. So I don't think so. I think it's going to make that part better for people. I'll tell you the part that I do worry about, and just not even just plastic surgery, but medical field in general, is I worry about the ripple effect of this in terms of adverse health outcomes for patients for the next 5 to 10 years. And for this, because if you think about it, going back to what elective procedures were, here in Texas, imaging centers shut down unless it was a an emergent something. breast biopsies, colonoscopies, those type of things all shut down for 2 months. And if you think about it, a lot of people, one, the system can't just handle 2 months worth of work and say, okay, we'll work you in. That's not doable. A lot of people, unfortunately, will just be like, oh, I missed this one. I'll come back when I'm due again in another 2 years. Now you have a 4 or 5 year gap where they're not doing it. And so I think we're going to see some late cancers. I think we're going to see some unfortunate late stuff. We've seen here in Texas where some people have had really bad outcomes at home because of COVID. They're afraid to come to the ER or the hospital or to see their physician because they're so afraid of COVID that their diabetes, their hypertension gets out of control.
Right. I know my own parents needed to were trying to get into the Mayo Clinic.
Hmm.
Dealing, my mother has been in incredible pain, and they called for an appointment, and they said we can't even take them when we're booked through next year because they have such a backlog, and it's heartbreaking, right? Because people who need these services, you're absolutely right. How do you catch up on 2 to 3 months of being down and closed?
2 to 3 months. And, if we circle back, we're still running a modified schedule. So we're not
Right.
even seeing the 30, 40 people that we were seeing, before COVID. So we can't even play catch up because we can't play keep up yet.
So on that, do you think that, I mean, people are gonna is supply and demand thing? Are prices gonna should we expect prices to go up for things like filler and Botox and
I, I think here at the very initial, I think people are going to be able to take advantage of some specials, and Allergan and some other companies have pumped some stuff in terms of brilliant distinctions and other points that patients can look forward to. So if you're listening and you're a patient, ask your provider, go online stuff. There's some good deals to help you out. But I think once this first wave goes, I think you are, especially if this stuff doesn't come back, because at some point practices have to make up some of the cost because PPEs are expensive. Spacing out patients and hiring more staff to help with testing and follow up labs and those type of things that test themselves are expensive, and so all that cost gets pushed somewhere.
right? Oh, man, it's just who knew? Who knew that when we had that conversation? I can't believe it's months later and we're just still saying, wow, who knew? But it's nice to know that in Texas, you're sort of coming out on the other side of it.
It's been I live downtown Austin, and it's been pretty interesting to see how many people are out and about, how many people are at the restaurants. Some of the things that's been pretty heartwarming though is how many stories you hear of people going to restaurants and leaving $100 tips on a $20 bill, or things like that, which is it's just amazing that so many people have come out to support and help and do some different things to for the community and their fellow people. And so I think that's been pretty incredible here in Austin, at least.
When you say that at 7 o'clock in New York every night, they are still clapping and cheering. And I get the chills because, it's something that we're all part of. And it just shows that as alone as this situation can feel sometimes, you know what? We're all in it together. And not that you want anybody else to be miserable, but sometimes it's good to remember that we're all going through the same stuff.
No question, no question, because it's definitely easy to feel isolated and like your problems are mounting, and you don't realize like, hey, everybody's going through what I'm going. Everybody gets the blues now and then. So, and I always tell people if you've got the blues, somebody else does. Pick up the phone and call somebody. Somebody pops into
Yeah.
your mind. They probably just need a few minutes of your time. Just hey,
Yeah.
what's going on? What's up?
It's something so easy to do, and you know what? It's always gonna leave you, the person who's doing the calling, feeling better too.
And even if you miss them and you just leave a message, hey man, just call to see what's up. Give me a call if you need anything. I mean, even if they don't get a chance to call you back, just seeing that this message in here, they're like, oh wow, somebody's thinking about me.
Now I have to ask, just because again, we're still in this phase where it's not open yet. Was there anything that you noticed that you were surprised of procedures people came back from? Because I swear I looked in the mirror this morning and it's the first time that I really was like, okay, Botox is all gone. Any muscle mass that I'd had at the gym is kind of So like, do you think that like are people coming in for M sculpt or like beyond the I need the Botox and fillers or something that surprised you?
No, I honestly was surprised that people were so willing to come back so fast. And that's what I think in general, because even I've been slow to like go to restaurants and so forth. And it's so funny. It was my friend's birthday 2 while ago, and he named a few people. I was like, places. I was like, that's too crowded. I can't go, man.
Right. Wow. So
um,
vanity though. It just goes to speak to our we need to
It
look
does.
good.
I,
You
I do
know,
think I do think M Sculpt is one that has definitely been super popular in the short term, because I think people are a little worried about gyms, because, and not to put anything on gyms themselves, but it's just hard. I mean, most of the gyms are pretty big. Some of us sweat more than others, and just the idea of wiping everything down and so forth, I think is really really hard, because for a small office like us of 2,000 square feet, it's a good endeavor for us to to wipe everything down and so forth. So I could only imagine a 10,000 square foot gym.
dude, in my apartment that's only half the size of it, it feels like it's an all-day affair to kind of go through and wipe everything down and clean. So I can't imagine. And especially when you have to do it between every single patient.
Mm-hmm.
Oh, well, I thank you so much for your time, Dr. Franco. It's always such a pleasure. And I hope, in another couple months we can get back up and celebrate, back to just back.
I know. I appreciate you having me. I think it's going to be exciting if we're looking for a bright side. I really think this is push technology, and it's going to be interesting, even in the world of plastics and medicine. I hope that we really keep, all the good, skills, all the good habits, all the telemedicine that we have lost. Because if you think about it, you can't, the way the system runs now, not to be on my soapbox, but the way the system runs now, we can't afford everything for everyone, but the cost of us doing telemedicine is so much lower. If you
Yeah.
think about that money being sent for primary care and the access for most people to at least get some primary care, the amount of people that I can do in front of my computer and help, I mean, I really hope that we take from all the bad some of this good, and spread it, because we can spread the resources we have much much farther now.
Yeah. And maybe there will be even a greater push towards these, non-invasive procedures.
Mhm.
If people right now, are you finding that the people are worried about getting some of the more invasive stuff done? Are people coming in for CO2 lasers? Are they?
Some of those have been hard, because some of that stuff was in a phased entry because of us, because of the worry about causing smoke, or these plumes, that they call them in terms of that. So that's some of the laser resurfacing stuff has been smaller. What's going to be an interesting trend, if we talk again in a couple months, is where does it go? Because to your point about, people's disposable income, if there's, people are worried about jobs and those type of things, I would be really surprised if we don't see a transition over the next 3 or 4 months, when stuff really starts to set in, and much of the lower cost procedures, like little office procedures, spike, because people are like, hey, I'm not going to spend 15,000 for a facelift, but you know what, maybe I'll spend $125 to at least feel good and get out of the house and like feel good about myself, do at least a little refreshing for my skin, and then next year or 2 years from now I'll do something else. So I think you're going to see a lot of these minimally invasive stuff actually take off, as people are like, I want to do a little something, but I'm not going to use up all my savings.
What? I got to ask you, what's $125 in your office?
I think Texas prices are a little bit different than New York, but you can get a regular facial for 125
Okay, a
$25.
facial, but like we're
Yeah.
not talking Botox. No, no,
No, no,
no,
no. We're
no,
not
no, no,
talking
no.
Botox or
Because
fillers
I was like,
or
I will be on a flight. I'm there. I'm coming. I'm already booked.
I can get my flight, I can get my Botox all for less.
Yeah, it's amazing. Oh, it's so good to laugh with you, and thank you always, for giving us a little bit of inspirational. And I do think that there's going to be, you know, feeling good is so important in these times, and it's beyond vanity, right? When we
Mhm.
feel good, we carry ourselves different, we boost our immune system. I mean, it all sort of ties together. So I just hope that we can get through this, and everybody try to stay as positive as we can. And we're definitely going to catch up in a couple months, because I love talking to you.
Awesome. Well, I appreciate you having me, and hopefully I got more good news when we talk in a few months.
Amazing. And if people want to reach out to you, Dr. Franco, what's the best place to find you?
They can follow us on Instagram at at Austin Plastic Surgeon. Our website is morebeautifulyou.com. And so those are the two easiest ways. But follow us every day. We post our surgeries, what's going on with us. I haven't gotten a haircut during this whole time, so I'm growing out the curls here. I think I got a little mullet going on, so you can follow the mullet trend here.
It looks good, and I gotta tell you, for all of you who are just, like, sitting home and are done with, like, you've streamed everything on Netflix, your videos are so good because it's lip filler. It's, like, all the good, juicy stuff that we wanna see, so thank you for that. And of course, everyone, if you have any questions you want us to pass along, write us, hello at Art Beauty Podcast. You can find us on Facebook, on Instagram, and on YouTube at Art Beauty Podcast. And we want you to like and subscribe and do all the things and tell us what you want to hear. We'll bring Dr. Franco back. We will grill him about whatever it is that you want to hear in this time. The stuff that's important to you matters to us. And as always, we will see you next Tuesday. Bye.
Thanks, Amber. Bye.